We are your hosts, Nikki Shore and Jesse Swain, and you are listening to the American Journal of Infection Control podcast, Science into Practice, brought to you by the Association for Professionals in Infection Control and Epidemiology to highlight work published in our peer-reviewed journal, ACHIC.
Join us as we speak to those in the field of infection prevention and control, like us, as well as other experts, to learn about some of the latest research in the field and how it can be put into practice. We hope you will listen in, learn something new, and apply this information to your work. If you are not a researcher already, we hope this podcast will get you thinking about areas where you can carry out your own research.
Well, hi, everybody. Unfortunately, it's just me today. Jess can't be with us. Her dad's sister is in town, and apparently she's so obsessed with killing germs that they call her antibacterial. The show must go on, though. But really, she is off doing important infection prevention stuff. So I'm here to talk about something very important and kind of close to my heart, of something of interest to me. I'll be speaking with Dr. Bernadette Melnyk about her article, Associations Among Infection Prevention Professionals' Mental Physical Health, Lifestyle Behaviors, Shift Length, Race and Workplace Wellness during COVID-19, which is featured in the latest ACHIC, American Journal of Infection Control. Dr. Melnyk is currently Vice President for Health Promotion, University Chief Wellness Officer, Dean and Helene Fuld Health Trust Professor of Evidence-Based Practice at The Ohio State University, and she is also Professor of Pediatrics and Psychiatry at Ohio State's College of Medicine. Boy, we get some busy people on here. Dr. Melnyk is recognized nationally and globally for her expertise in evidence-based practice, mental health, intervention research, and her innovative approaches to a wide range of health and well-being challenges. She is both a pediatric nurse practitioner with an adolescent specialty and a psychiatric, I keep getting hung up on that word, psychiatric mental health nurse practitioner. Dr. Melnyk has received numerous national and international awards, including being recognized as an Edge Runner 3 times by the American Academy in Nursing for her cutting-edge evidence-based programs and national initiatives, and the Lifetime Achievement Award from the National Organization of Nurse Practitioner Faculties. She recently received an honorary Doctor of Science degree from the State University of New York and served terms on the United States Preventative Services Task Force, the NIH-NINR National Advisory Council for Nursing Research, and the National Quality Forum's Behavioral Health Standing Committee. Dr. Melnyk is founder and current president of the National Consortium for Building Healthy Academic Communities, a member of the National Academy of Medicine's Action Collaborative on Clinician Wellbeing and Resilience, is an elected executive board member for the National Forum for Heart Disease and Stroke Prevention, and recently served on the National Academies of Sciences, Engineering, and Medicine promoting emotional well-being and resilience in children and adolescents expert panel. She has over 490 publications, is an editor of 7 books, and has received $36 million in grant funding as PI from federal agencies, including NIH and foundations, and is an editor-in-chief of the top-ranked journal Worldviews on Evidence-Based Nursing. Dr. Melnyk is an elected member of the National Academy of Medicine, the American Academy of Nursing, the National Academies of Practice, and the American Association of Nurse Practitioners. In her role as Chief Wellness Officer and Vice President for the Health Promotion at The Ohio State University, the first at an institution of higher learning in the country, Dr. Melnyk spearheads the building and sustaining of a wellness culture that supports healthy lifestyle behaviors and improved population health and well-being outcomes using an evidence-based quality improvement model that targets the grassroots of the organization through top leadership. This comprehensive model has been highlighted as an exemplar by the National Academy of Medicine's Action Collaborative on Clinician Wellbeing and Resilience. So welcome, Dr. Melnyk. I'm so excited to have you with us today.
Thanks. I'm excited to join you.
Yes. Well, why don't you give us a quick rundown of what got us going, what got you going on this article?
I have conducted several national studies on nurses, pharmacists, now infection prevention professionals. And what's really interesting in all of these studies, we're seeing the same outcomes regardless of the health profession.
So I saw that only 6,000 APIC members out of 16,000 were randomly selected to participate in the study, and only about 926 of the 6,000 selected responded. Were you surprised that only about 15% responded? And do you think that the results would have been significantly different if more IPs had responded?
I was not surprised at all. 15% is actually a decent response rate, especially during the COVID-19 pandemic. People are surveyed out. They're undergoing survey fatigue.
True.
That's why it was so key for us to draw a random sample instead of a convenient sample. When you draw a random sample, you can generalize the findings to the rest of the organization. So I feel pretty confident that even if our sample size was larger, we would have probably gotten very similar findings.
True. Yeah. And you're right. I appreciate that background where we are dealing with some COVID fatigue, and that random sample definitely lends some credence. So there were several different tools that were used to assess health and well-being. Can you describe the tools and why those were selected?
Absolutely. I use valid and reliable tools whenever I can, and I tend to use the same valid and reliable tools in all of my national studies. For example, the PHQ-2 for depression is a valid and reliable screen. The GAD-2 for anxiety, again, it's valid, it's reliable. We also use a one-item burnout question that's valid as well. Using valid and reliable instruments are so key so you can have some, really decent confidence in your findings. What people have to remember, these are screening tools. So they're not diagnostic tools, but they are screens, again, that are valid and reliable.
Right. We use a lot of those at the hospitals in my system, a lot of those screening questions. There's a lot of push, of course, towards social determinants of health. So very familiar with those. And I had a question about the burnout question. The question says it's structured as, given your definition of burnout, was a definition given to the subjects, or is that a subjective interpretation for the respondent? Tell me more about that question.
Yeah, it's a subjective interpretation for the respondent.
That's what I thought. Okay, so tell us about some differences that were illustrated from the survey between frontline IPs and IPs that were working in other roles.
Yeah, so what we found in this study, again, very similar to some of our other studies, those on the front line, as well as administrators and directors, had more negative mental health impacts than IPs in other roles. Those with organizational wellness support, and again, this finding repeats itself in every national study we do. But to my knowledge, we are the only researchers that have included perception of organizational wellness support in our studies. But those who perceived their organization supports their well-being to a greater extent, they have better outcomes. So It really gets back to organizational support for well-being.
Yeah, I'm interested in some of the wellness support from the organization. So we'll get into the meat of that later because I'm pretty familiar with my organization and those wellness programs. But before we do get into that meat, let's talk first about what some of the negative impacts of those longer work hours were on IPs.
Yeah, I don't think it's going to be surprising to many listeners.
Probably not.
Rates of depression, anxiety, and burnout were high. We had 21% of the IP respondents meet the cutoff for clinical depression. About 30%.
Wow.
Yes, about 30% for clinical anxiety, and 65% reported burnout. That is worrisome.
Yeah. Yes, it really is. And I know that COVID didn't help. We've had I've experienced other issues in some of the facilities that have led to that. And it's that's shocking and really sheds a light on a need. So I'm really appreciative of your work. And there are some racial and ethnical implications to the study too that I want to talk about. So for instance, it was interesting that the white IP respondents reported getting greater than or equal to 7 hours of sleep at night or 150 plus minutes of moderate physical activity a week and getting their servings of fruit and vegetables in, every day. And they reported this more frequently than the racially and ethnically diverse IPs. Do you have any inferences as to why?
Yeah, again, it may be some cultural differences. We did not include a lot of other variables that might give us more insight into that. But I think what's so important, regardless of race, ethnicity, few IPs who responded to this survey met national guidelines for sleep, physical activity. Only 18% of respondents were meeting physical activity guidelines. Fruit and veggie consumption, at least 5 a day, only 7% of IPs were meeting that. So health professionals, it's striking to see, even though we as health professionals should be role modeling, right? Walking the talk and meeting these evidence-based recommendations, so few do.
Yeah. I've noticed that as a trend in the healthcare industry anyways. Nursing and all the disciplines, it's a really stressful job. And sometimes, and that's another point I want to bring up. It's a stressful job. And some of the racially and ethnic diverse IPs reported no smoking and no or light alcohol use more frequently than the white IPs, which I thought was interesting because that's, the prior question kind of reports a different sort of approach to health. And any conclusions as to why or how we're dealing with stress and what's going on?
Yeah, I think during COVID-19, if you look at even the general population data, people have coped with COVID through unhealthy lifestyle behaviors,
Right.
unhealthy eating, declines in physical activity. And we've seen a big increase in alcohol use, particularly amongst professional working women. Those
Mm-hmm. Mm-hmm.
have been the kind of go-to strategies to
Mm-hmm.
get me through the pandemic. So we've seen weight gain. In fact, people joke about COVID-19 meaning 19 pounds of weight gain
Mm-hmm.
during the pandemic.
I remember reading that about increased alcohol usage in working professional women, that it was mostly women that hit. And I myself have had some weight gain too, so I can understand that. Yeah, it's been a tough time for sure. And I'm sure that doesn't help with that 65% burnout rate. Well, I guess let's switch gears just a little bit, and we'll get into some of the wellness program information. So the survey indicated that IPs from organizations with wellness programs were impacted less by the COVID-19 pandemic. You referenced some of those wellness programs earlier. What types of support are key components to an effective wellness program?
We take a multi-component approach to wellness at our big public university that actually includes 7 hospitals. So we tackle wellness to the top leadership, the managers, the supervisors, faculty, to the grassroots of the organization. We do that all within a culture of well-being, because culture eats strategy for breakfast, lunch, and dinner. You've got to make healthy lifestyle behaviors the default in the system, the standard or the norm. But I will also tell you, we tackle this by fixing system issues, because that's key. We can't put this all on our professionals. Yes, is it true? Health professionals typically do a great job of caring for other people, but they don't often prioritize their own self-care. You've got to do both. You got to
Guilty.
tackle the system issues and offer the programming.
Absolutely guilty of that. And I know most of my coworkers are pretty guilty of not prioritizing their health sometimes. Like you said, we are so focused on taking care of other people, we do neglect ourselves sometimes. And I like the quote you said, the phrase culture eats strategy. And unless, and you're right, unless we have that culture in the organization that promotes wellness and health and well-being, then we're not going to take care of ourselves, and that's going to impact the entire system, really. So what let's get more into those programs. What are the effective strategies? Are we focused on promoting more diet, more exercise, more meditation, or what are some of the most effective approaches that you've seen?
You know what? I did a systematic review with our team working with NAM's Action Collaborative. We looked at a combination of studies. What works for physicians and nurses? We found cognitive behavior skills building, mindfulness, gratitude, deep abdominal breathing, health coaching. So all of these things work. The key for healthcare systems is to rapidly translate what works into their real world clinical settings. Unfortunately, it still takes 15 years to translate findings from research into clinical practice to improve care and outcomes. We know what works. We just got to get it translated into
Yeah, absolutely.
life. Yes.
Well, I've read so much. I have read a lot in the past year or two about cognitive behaviors and how that affects, like you said, gratitude, practicing gratitude. I've read a lot about that and how that kind of rewires your brain. And it's just, there's a lot of information coming out about it. So your research is very important. And I thank you for sharing it with us. And I kind of want to wrap up and
Yeah. I always say take and give a dose of vitamin G for gratitude daily. It so decreases stress and improves mood. If we could get everybody just to do gratitude boards in their units, help people practice that daily, that simple strategy can yield great outcomes.
Right. And it's sort of kind of tempering your sympathetic nervous system or kind of tapping into that parasympathetic area of your brain and really getting yourself to calm down, do those cognitive behaviors, practicing gratitude. I have read a lot about how that really rewires your brain, and it's just really, really interesting. So I'll try to take my dose of vitamin G daily. I promise. I appreciate you promoting that. So everybody listening, get out your journals and do a vitamin D day or vitamin G daily. Tell us a little more about the Mind, Body, Strong, and Here programs.
Yes. So about 28 years ago, I decided to manualize cognitive behavior therapy because we know it's the best first line treatment for mild to moderate depression and anxiety, yet so few people get it. So I've done about 25 studies. Every individual who gets this program drops depression, anxiety, suicidal thinking, enhances healthy lifestyle behaviors. So about 5 years ago, I decided to adapt it for clinicians. And we did a randomized clinical trial. Showed the same great outcomes, drops in depression, anxiety, stress, and even 6 months after clinicians, nurses in particular, went through this program, they had better outcomes than the placebo attention control group. So we've been scaling that program nationally with really great outcomes now. And that's wonderful that more clinicians are getting it. In fact, I just got a big grant from the American Foundation for Suicide Prevention to digitalize that CBT-based program so it could reach more clinicians across the United States.
Well, congratulations. That is obviously, from our discussion, very well needed for the healthcare community. So it sounds like we know what to do, or we know what we're supposed to do, improve our lifestyle habits through cognitive approaches and decreasing stress and practicing gratitude. What would be your key takeaways for our listeners? We know what to do. How do we do it? What do you want to tell our listeners?
For leaders in healthcare systems, we know the root causes of burnout. Let's fix the system issues, including no more 12-hour shifts. Because just like our other national studies, we found the longer the shift work, the more burnout, depression, and anxiety that the respondents experience. The other thing I would say is appoint a chief wellness officer. Give them, the authority, give them tools and resources to build wellness cultures and offer evidence-based programming. So there are solutions, because burnout is costing us about $4.6 billion a year. And it also impacts quality and safety. Investing in wellness is not a nicety. It's a necessity.
So I have one last question then. Investing in wellness. Do you find that that is something that organizations are quick to cut when we're doing budgets? And if so, how do we prevent that? How do we combat that?
Yeah, I think it's still considered by some this warm and fuzzy thing. We have return on investment data, value on investment data that shows when organizations invest $1 in well-being of their people, they get a return of $2 to $4. So we've got to make a business case to the C-suites across America. Again, this is not a nicety. It's a necessity that brings back dollars to the organization with reduced turnover rates, less medical errors. It's critical.
Yeah, I would love to read that data. That's important, and it's near and dear to my heart. I appreciate wellness approaches. I agree with you wholeheartedly that you can really do a lot of lifestyle changes and really improve cultural health, cultural well-being and cultural health. So that's interesting. I really hope people take stock in this and take their vitamin G daily and give this a lot of thought. So I really, really appreciate having you on today, and I really appreciate your research and all the information you have to give. So thank you very, very much for joining us today, Dr. Melnyk.
AGIC Science into Practice is created by the Association for Professionals in Infection Control and Epidemiology with input from the APIC Research Committee and Pat Stone and Jean Brandt at AGIC, and APIC staff Shanina Knighton, Chris Ruiz, Bobby Gulshan, Christine Miller, Kaylee Deaton, and Kelly Lynn Russell. We work in partnership with Human Factor and audio tech Blake Alphen. Podcast episodes and to access information about this podcast and the field of infection prevention and control, go to our website at ajicscienceintopractice.org. That's AJIC scienceintopractice.org.